true goal of the campaign is to cover enough distance as a community to reach the moon. So it's about 239,000 miles from Earth to the moon. And since this is our launch, we're launching into space. That's kind of how the theme works. And so we want to get enough people on the app to where we could cover enough distance as a community to reach the moon. Ideally, we have at least 100,000 or so that participate in the bEHRathon. That way, everybody only has to do, 1 to 2 miles, nothing crazy on bEHRathon day. But, if we don't get that many, let's say we get 20,000, then, each of us will have to do 10 miles. But the idea is to make it easier on ourselves, let's get more and more and more people involved. To participate and be a part of that, you can go to our Instagram at bEHRhealth.
Hey friends, welcome to Public Health Careers. I'm Omari Richins, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Kwame Terra. Kwame is founder and CEO of bEHR Health Systems, where he is creatively addressing health equity by leveraging technology and culture. Kwame is a health equity visionary, leveraging tech innovation, cultural connection, and data-driven solutions to transform Black community wellness. In April 2025, he broke a world record by walking over 2 million steps in 30 days to spotlight the launch of bEHR Health app. His lifelong dedication to health is reflected in his decade-long plant-based lifestyle and commitment to preventive wellness. From his days as a student researcher to launching health tech with a global impact, Kwame blends endurance, innovation, and activism to reimagine how communities engage with health. He conferred a bachelor's in biology at Xavier University of Louisiana, then a master of public health and health equity at Xavier University of Louisiana. In today's episode, you'll hear and learn more about how Kwame blends endurance, innovation, and activism to reimagine how communities engage with health, why creating health-promoting environments is essential for community wellness, why preventable conditions account for a significant portion of healthcare spending, and how he's trying to change this, and how startups and health technology can effectively address urgent health problems, and much, much more. Be sure to hit that subscribe button and hit a like if you have not as yet. Enjoy today's episode.
Hey everyone, I'm Kwame Terra, CEO and founder of bEHR Health, and you're listening to Public Health Careers. We're a startup company based in New Orleans, Louisiana, committed to maximizing health in the Black community. We give individuals a health score, kind of like a credit score, but for your health. And your score changes day to day, week to week, depending on how you change. So if you go on a run or a walk one day, your score goes up a few points. If you get 3 hours of sleep one night, score goes down. And based on those changes, we make recommendations for how you can improve, as well as connect you with healthcare providers, resources, and experiences to elevate your wellness. All of this data goes into what we call the Black Electronic Health Record, which is a real-time database of all of our user health insights, which we use to inform and drive community health solutions in the Black community. Born here in New Orleans, grew up in Houston, Texas, pre-med for undergrad, ended up doing my master's of public health with a concentration in health equity. Just always had a passion for health and wellness. Started off more so for myself, but after the COVID-19 pandemic, I just wanted to do something so the next pandemic or next challenge that we face in the Black community, we're in better health, have a better outcome. And so that's how we got to where we are now.
Definitely appreciate you sharing all that insights into what you all are doing and how you get there, how you got there. And I'm excited to learn more about that path. And I definitely appreciate the work that you are doing and intrigued by how you formulated and got into this point to create this app to think about health scores and all of that. But before we get into all of that and your journey, I would love to know, how do you identify and tell us a little about your personal background?
Yeah, so, I'm a Black man in the United States of America, born here in New Orleans, Louisiana, grew up in Houston, Texas, made my way back during for undergrad. So I went to Xavier University, Louisiana, where I studied biology. I was pre-med, and early on, I was introduced to research, where I got to study at UCLA, I got to study at Brown over the summers in between semesters. It was just really introduced and kind of inspired by the idea of addressing problems before they develop, right? The majority of our healthcare system addresses conditions once they've already developed, right? And in a real way, spend the majority of our time doing damage control, right? Trying to keep sick people alive as opposed to trying to create health. And that's what that system was designed to do. That's not necessarily a knock on the system, but it is a reality. And Right now, we're spending about 90% of our healthcare dollars on preventable conditions. And my job, my passion, and commitment as a healthcare practitioner is to get that number as close to zero as possible, right? We should be spending the majority of our healthcare dollars on diseases that we don't completely understand yet, right? That we don't have cures to, by investing in prevention on the front end in the system. And so that's kind of my general thesis or premise as it relates to health and wellness. And when I say we're a healthcare company, I think we're starting to shift to more of a health and wellness company, because in healthcare only accounts for 10% of health outcomes, right? Going to the doctor only affects 10% of how healthy you ultimately are. The majority of your health is driven by the life you live on a daily basis, how you engage with the world. And so our vision is to really help people curate a life experience that is health promoting. Right now, our current healthcare or our current environment is disease promoting, right? There's fast food around every corner, increasingly sedentary lives. And so our job is to help not only encourage individuals to prioritize and make wellness a part of their life, but like how do we influence and restructure environments such that they promote health, making it easier for everyone.
I'm glad that you're able to raise a lot of those points up. And I actually just recently wrote a little bit about that 10% being related to medical expenses, health expenses. And I completely agree with you, especially in what we consider the powerhouse of the world, a very, very wealthy nation. We should be doing better on the sense that we should be not we should be able to invest in our preventative health so that we are able to worry about the bigger issues in a better way, if that makes sense. I feel like I'm getting a little bit of word jumble there, but you definitely understand what I'm trying to say. And health promotion and the environment, I'm just, as you were saying that, I'm thinking about, I went to a beach in North Carolina this weekend, and I wanted to walk to get some coffee and food with my girlfriend. And just to walk across the highway, there were literally there's no light to push, no zebra crossings or anything. And I'm just thinking about like how bad this is. And I'm always complaining about it, because if you've ever been to somewhere like the Netherlands and you come back to the US and you just realize that cities don't have to be built this way, and they can really be built people-centric in a way that promotes health.
Absolutely.
I just think about these things, and to your point, it's like, how do we create environments that people are able to really live their best life? Okay, so at Bear Health, you're not just building a tech product; you're reshaping health culture. What inspired you to create Bear Health?
Yeah, so like I said before, I've always been into health and wellness throughout my life. Former athlete, some of us would say that we're still currently athletes. And as you notice, a lot of people getting into running and run clubs and stuff like that now. But yeah, former athletes, so always relatively health conscious. My dad was really strict with us about what we put in our bodies. Like I didn't drink any Coke since I don't know, maybe elementary school. Like me and my siblings stopped drinking sugary drinks and Cokes and stuff like that. Always, I was the person getting the shrimp salad or the shrimp pasta at the restaurant after our team games or what have you. So always been into health and wellness, but it has really been mostly for myself and my personal performance. And it was actually during the COVID-19 pandemic. My aunt had actually sent me a message while she was at work. So she's a physician's assistant. And she said, "Hey, nephew, I think this would be a great time for you to kick off your healthy eating initiative again." So I eat a plant-based diet. I have been for 10 years now. And so I'm the vegan person in the family. And so that's kind of why she spoke specifically to the healthy eating initiatives that I've done. And, I took that seriously, right? So we're all sitting in the middle of a pandemic, and the virus is preying on the most dispossessed and unwell among us. And, what stood out to me the most was that the majority of the conditions, the comorbidities that put people at risk for severe outcomes from the COVID-19 virus are preventable. Hypertension, type 2 diabetes, cancers, that these things, assuming that you're able to live well, these aren't conditions that you have to have, right? Just because something is common doesn't mean that it's normal and that it should exist. Obviously the majority of us have one or more chronic condition, majority of adults, but that's not just the way it is. That is the way it has become as a consequence of what we've created. But fortunately, at any age, you can slow, stop, and reverse the trajectory of these conditions. And I know that. I've watched it happen. I used to work in a plant-based heart clinic in Houston, where people would come in with type 2 diabetes. They'd come in with hypertension, and they'd be prescribed medications because medication does have its place. We do need to help manage these states so that people can not have a significant health event like a heart attack or a stroke or something like that and end up in the hospital. Like, we do need medication to manage these things. But in addition to being prescribed medication, the physician would prescribe a whole food plant-based diet. And there's a kitchen connected to the clinic and everything. And people would come down or off their medications in a matter of weeks, just from changing their diet. And so I've seen it happen. I know it happens. And because of that, that gave me the confidence to want to build something, again, so that next pandemic or next challenge that we face, we're just in better health, right? We're in a better state of health to have a better outcome. Like, the healthier you are, the more effectively you can engage and contend with reality, whatever is thrown at you. And so, my first thought was, I don't think we know how bad we're doing as it relates to our health in the Black community. I know we should be exercising more. I know we should be eating better. But I don't think many of us know that if we don't get it together soon, we can have a heart attack at age 45. Our bodies are aging faster in the Black community as a result of everything that we experience here and our lifestyles. And my biggest fear is my friends, losing my friends, right, as we get into our these, and their children having to live without their parents from a young age, from a preventable condition. My mom's good friend lost her husband to a stroke at age 46, leaving their 13-year-old son to have to grow up without a father. It's already hard enough, right? Life is already hard enough, and to lose a parent to a completely preventable condition, on the whole, it's I regard it as unacceptable. And so I've made it my mission to prevent it.
Yeah, I appreciate that sentiment, and I think it's very, very important. And I also think it's important to understand, like, a lot of people do know, like, they have to do things that are better, and they do know, like, what they're doing is unhealthy, but they also are in an environment, or they have the systems around them. Like that, I think, for example, just about the recent One Big Beautiful Bill and the proposed cuts to SNAP, and how that is going to affect so many families, so many Black families, so many poor families, so many rural families, so many urban families, but disproportionately rural Black, Latino, immigrant families. SNAP was in many food banks, was like, what, every one meal that a food bank was giving out, SNAP was giving out 7 to 9 meals. So how do you envision the work that you're doing to work to also improve maybe some of the systems that are able to allow people to achieve better health?
Mm-hmm. Yeah. It's a good question. I may have a hot take on, despite the system being what it is, you can still be well, Black and well, in this country. And I say that because, we've known the conditions. The conditions have been what they are since we got here. They used to be much worse. Maybe now they're a little bit better. And at the end of the day, and part of, like, what we're trying to communicate with our platform and our brand is that your health needs to be self-directed. It's on you. You determine your health. And we need to help people understand why we need to make it a priority, despite what we're up against. My grandfather is 87 years old. He grew up in the Jim Crow South, right? He used to tell us stories about how they would require literacy tests for voting. And he said they would ask them things like, on the literacy test, you're thinking that it's going to be,
No, it's ridiculous questions.
yeah, you think it's going to be, write your name, spell the presidential candidate's name, something simple, right? But it's like, how high is high, right? How many marbles are in this glass jar? You got to know the exact number, or you're illiterate. And so, he's faced everything that you can imagine someone face in this country, but he's 87 years old without a single chronic condition. because he's chosen to educate himself and prioritize his health, and he's benefited from it. And so, as there are going to be constantly changes that make our lives harder. That's just the reality that we live in, because there are people with what I view as terrible ideas that are just as committed to those ideas as we are to the ones that we believe in, that we believe are good for everybody. And so what I hope that in this context we're able to do, because we are a startup company, we're a for-profit entity, is that we, in this moment, help people understand that they have the power to take care of and help help themselves. And when it comes to, for example, eating healthy, I know that there's like an idea that it's super expensive to eat healthy, right? Well, turns out to be the case that some of the healthiest foods in the world are actually very, very cheap, right? Whole grain rice, regular white rice, beans, a variety of beans, obviously mixed like vegetables, a variety of vegetables, potatoes, things like that. These are actually very, very cheap products, right? So, I remember growing up, I didn't think that we were poor or anything like that, but we always ate a lot of spaghetti and we ate a lot of beans and rice. And, as I became an adult and started cooking for myself, I just realized that these are just like very cheap, options to eat, but they also are health promoting, right? Especially if you're getting in the whole grain versions of them. And so it just comes down to what our priorities are. If we want to experience a certain lifestyle that comes with some expensive options, and then I get it. It will be hard, right? But if we can again educate ourselves and help people understand um, that it is affordable, no matter your circumstances, to eat well and eat enough. And so hopefully we, like, our general message is like helping people understand that's possible. And just to speak to the health score a little bit, it's a number between 0 and 1,000 that represents your overall health, and it changes in real time depending on how you change. And the main reason that I created that was because I want to communicate clearly to the Black community our current health status, because I don't think we know. And when people see their score, especially if their score is low in a particular category, it makes it a little more real for them. Health is complex, and to be able to simplify it into an individual score may be the motivation that they need. Because once you do have the motivation that you need, all of a sudden things become more accessible. There's a few, as you probably know, there are a variety of factors as it relates to accessibility of something, right? There's affordability and availability. And honestly, for the most part in this country, and we'll see how those things change with this new bill, healthy food is affordable and available. And I say that with confidence in my experience, based on the focus of my studies in my public health program. It's not necessarily that there's just not a grocery store nearby. It's that because of individuals' experience, the foods that we need to be eating or purchasing at the grocery store are not the ones that we choose, even if they are available. And we've seen essentially that effort fail. And so, and also feel free to push back on anything that you don't necessarily agree with. But yeah, I guess I'll stop there. But that's what I hope is that this is just another reminder that the country is never going to go out of its way to make sure that we all have what we need. And therefore we need to take that fully upon ourselves to make sure that we do.
Yeah, I'm definitely in the camp of both, and I definitely agree with what you're saying, that it is, we all need to take our individual place and make the choices and really step out and say, like, our health is our priority. We have these, I don't know, cultural, societal, familial habits, and maybe they are not or they have not been serving us, and we need to do better. And I also acknowledge that there are many, many systems, and a lot of the work that I do, I work in like rural North Carolina, and there mightn't even be a grocery store. So I do acknowledge that a lot of people there do not have access, and even if they did have access, I don't know, the median income in some of these places is like 25,000, 35,000, which is that's really hard to live on. And
Yeah.
yeah, but I do believe it's a both and I do believe that we need to both take accountability for where we are and where our family, friends, community are, and say, hey, we can do better, as well as we need to ask more of the systems and the environments and try to hold politicians and leaders accountable and able to build a system that is right and just, especially for those people that are most vulnerable.
Hmm.
And in your work, you all are running the bEHRathon, which aims to engage with 1 million participants. Can you share more about that vision and how everyday people can get involved?
Yeah, sure. So in April, I took over 2 million steps in 30 days.
Why do you do that?
So to raise awareness about Bear Health and the official launch of our app that's going to be taking place in October. Right now, we are operating on our beta platform, but we've generated enough traction and gotten enough engagement over the past year and a half to get migrated over to our own independent platform and to kind of celebrate that launch and just get as many people as possible engaged with that movement. We created why I decided to go after the world record for the most steps in 30 days. And I didn't know if I could do it or not. And I had been training a bit for a 10K that was coming up in April, but I just took it one day at a time. And the first day was incredibly challenging. I walked probably 14 hours that day. I was walking too slow. I didn't have my pace down just yet. And so I started walking at 5 a.m. Maybe was off my feet 3 hours throughout the day, and I finished walking at 11 p.m. And it's funny, I was literally walking around my friend's island in her apartment at the very end, just trying to get the final steps. And I was like, man, how am I going to do this for 30 days in a row? Because that's another thing. I had no margin for error. I had to do 67,000 steps a day, about 30 to 35 miles of walking per day. And if I missed 20,000 steps one day, it's going to be hard to make that up. So it definitely was a challenge. I would say that was probably the most challenging aspect of it, is that there was no margin for error. And there were nights I would immediately, as soon as I finished walking, I would just lay down and then I'd wake up and then get back to walking for the next day. But it was a really cool experience overall. Like I said, I averaged about 67,000 steps per day. My highest day was 87,000 or so. And I was really encouraged that my body was able to kind of adjust. My first 5 days were really tough, and I felt it everywhere, all day, every day. There would be times that I'm walking, and then all of a sudden there'd be a shooting pain in like the inner part of my knee. I'm like, what was that? I stretched for a second, walked for another hour, all of a sudden same pain. I'm like, okay, so what's going on here? And I have no idea. My body's just freaking out because I'm putting on, ridiculous amounts of miles. But after about 5 days or so, started to adjust. Started fueling properly. I wasn't fueling properly in the first few days. It's just hard to keep up with that much demand, and I already don't eat that much in general. And so to have to ramp up how much I was eating while also ramping up how much activity I was doing, it's just a lot. It's just a lot of effort in general. And so it was difficult. So people did start bringing me food, lots of beans and rice, and we got it done, man. So that campaign was just, kind of kick it off. And at the end of the campaign, people kept asking me, what's next? Which I was actually confused every time somebody asked me that. Like literally on the last day, just, finished crossing 2 million steps. So I was like, what's the next challenge, bro? I'm like, man, I'm not even thinking about that at all right now, I don't even know why I would be thinking about that. But, I took that seriously and then kind of thought on it. And that's where I came up with the idea for the bEHRathon. And so the bEHRathon is in keeping with the theme of breaking world records. We're going to try to break the world record for the most people participating in a virtual run/walk event for the official launch of the Bear Health app this fall. And the theme is Bear Health to the Moon. So our first goal and true goal of the campaign for this year anyway is to cover enough distance as a community to reach the moon. So it's about 239,000 miles from Earth to the moon. And since this is our launch, we're launching into space. That's kind of how the theme works. And so we want to get enough people on the app to where we could cover enough distance as a community to reach the moon. Ideally, we have at least 100,000 or so that participate in the bEHRathon. That way, everybody only has to do, 1 to 2 miles, nothing crazy on bEHRathon day. But if we don't get that many, let's say we get 20,000, then each of us will have to do 10 miles. But like the idea is like to make it easier on ourselves, let's get more and more and more people involved. So yeah, to participate and not be a part of that, you can go to our Instagram at bEHRathon. To bEHR Health. There's a link tree in the bio, and it'll be there. You'll find the registration page there. It's free to participate, free to download the app when it does come out. There will be a subscription associated with it, but I think we're going to do like the first 3 months free, just so everybody can get into the bEHRathon and experience the app before deciding to make a commitment to being a part of our community. But it's only going to be $5 per month or $50 per year, so pretty affordable. But ultimately, we do want the platform to be free to everybody. And if someone emails us and says for whatever reason they don't want to pay for a subscription but want to have access, no questions asked, we'll give a subscription to the platform. We'll definitely start off like that. So yeah, that's what that's all about.
Well, congratulations to you. That's amazing that you're able to do that and like persevere throughout that. I can only imagine the strain and torment that your body and maybe even your mind went through during that time. And you said that you were preparing for a 10K. I looked it up. That's like 15,000 steps. That's nothing close, nothing close to 2 million. So I don't think
technically the 10K didn't count. It didn't count towards my steps because I was running. So.
Right. I remember people asking like, "What's next?" Probably like 24 hours of sleep. That's what's next.
Something like that. No, I definitely was laying down. I was horizontal all day. The next day, I think I took under 1,000 steps. I forget, but.
And when you were getting those pains in your knee, and I'd imagine the thoughts in your mind like, should I do this next step? Should I do this next mile? Well, what kept you going?
That I might be okay. Like. Sure, certain things are pointing toward me not being okay. Like my knees hurt every step. I was starting to get sharp pains in my head, like early on as well. So like dehydration and just lack of fuel in general. So that actually is what made me the most nervous throughout. And then I had some significant Achilles pain about 10 days in. So I could walk with no pain, but anytime I tried to push off at all to run, it's just severe 10 out of 10 pain. And so that was concerning because I don't want to damage my Achilles. I still want to be able to move for a significant amount of time in my life. And so what got me to keep going was, one, I told the world I was about to do it. I couldn't just like stop day 10 and be like, all right, guys, now I'm sure people would have understood and like everybody would have forgot about it. But then I'm this guy that sets ridiculously ambitious goals and doesn't even come close to them. And I don't want that for myself. What else helped me keep going? People bringing me food, people walking with me. My favorite part of the whole experience was when I would be on a walk, just like on the neighborhood kind of walk path. Someone had maybe seen a post on social media about me and would walk up to me like, "Oh wait, are you the walking guy? Like you are me and my friend's inspiration." And when I think about the word inspiration, that's all I think any of us should be trying to accomplish in life. Like that's the feedback loop that I think is most valuable for humanity, is where if the way that you live your life, what you choose to do, who you choose to become, makes someone else feel like life is worth living to the point where they would commit to something that makes sense for their life as far as growth, then I don't think that our souls really want for much more or need for much more than that. And that wasn't something I necessarily expected, like people to be inspired. I thought people were going to think it was like cool and interesting, but like to be inspired, that, when I think about public health, one thing that I think is missing from public health is like within the definition is something that speaks to that. Because right now the definition is public health is the art and science of prolonging life. We can prolong life for a long time and we can keep sick people alive. But like, how do we set up society such that we can prolong the desire to live, right? Because the desire to live is the root of longevity. If you want to be here, you can at least leverage that perspective to get creative about what you might need to do to be here as long as you possibly can, right? I don't know how to exactly measure these, but I've heard anecdotal stories of, people on their deathbed or just struggling with a condition. Those who really, really, really want to be here Or, your body's listening to you all the time. And these are just accounts from doctors that I speak with. If you want to be here, like the patients that really want to be here, like they are more likely to survive. Again, because your body's listening, your cells are trying to figure out, okay, well, I need to be here. Let me figure out what I need to do to make sure I'm still alive. And so that's really my vision with bEHR or my vision with public health is to how do we set up society such that people want to live here, be here as long as they possibly can, not to miss out on the experience that we've created, because we can do it. We should not be in these conversations about this big, beautiful bill or whatever it's called, and how now a significant amount of people aren't going to have access to basic needs. That's not what we should be talking about. There's more than enough to go around. These are unnecessary challenges that we're facing, and everybody would benefit from it. Everybody would benefit from everyone doing better. It's just a fact. And so, yeah, that's what I want to create. I know it's possible. And honestly, it's gotten challenging enough to where, we don't have much to lose. So, yeah.
Yeah. That makes a lot of sense. And I definitely think so. We should be worried about other things that aren't issues that we are creating for ourselves.
Exactly.
We should be worried about poverty and feeding all children, but we refuse to get there for some reason.
Mm-hmm.
And you shared a little bit about like what public health kind of means to you. Did you want to add anything else in, or did you want to go to your academic pathways?
Yeah, I mean, I think it's a good bridge into the academics. Yeah, public health is that definition that I just shared with you. Again, the art and science of prolonging life, and then again, I think we should add to that definition the art and science of prolonging the desire to live. I think that essentially is the life, liberty, and the pursuit of happiness. Right? I think that's maybe what they were going for there. They maybe had some intuition around that, but I don't think we've succeeded in that at all. But yeah, so public health. Yeah, public health to me really means creating a life worth living for everyone, and structuring society in a way that allows for all of the variety of interests and passions and preferences without taking away from others' interests and passions and preferences. And that's a really hard thing to accomplish. I don't think that like society is easy. It's a miracle that we are here now. Based on our history, it truly is. The systems that we've developed, how imperfect, we don't all kill each other every day. Like that's a good step. We used to be on some level in that way, and then now we're not. So that means it's something we're doing, pointing in the right direction. But obviously, we have a long way to go. But it's to me, it's more closer to kind of like society and the stories that we believe in, and that help us treat each other with respect, and ultimately reduce the motivation to create conditions that don't create health. When I look at blue zones, for example, those conditions don't really create disease, they create health. And not only are there physical factors or features of these communities that promote health, such as every aspect of the community is typically walkable. People walk to work, for example, very minimal to no fast food restaurants in these areas. Right. And then when the fast food restaurants start coming in, then you start to see a reduction in the outcomes. But they have this significant sense of community and purpose, right? Their life has meaning. They want to be here, and they enjoy who they're here with. So public health to me is less like a discipline of study per se. When I think about it, it's more about, it's like, how do we structure society the right way to maximize the potential of human beings and happiness.
And before you got to this understanding of public health, you began your collegiate journey with your bachelor's in biology at Xavier University of Louisiana. What drew you to bio, and how did that shape your early thinking of health? And I believe you mentioned your pre-med.
Yep, that's right. I ran cross country and track in high school. When I grew up, I wanted to be a professional baseball player. That was my life goal. But I was also pretty decent at running. 3 of my siblings also very, very competitive runners. My sister won state in Texas as a junior in high school in the miles. Just come from a family of runners. So I was running on the side, you could say, and I was playing baseball kind of as my focus. But my junior year of high school, I decided to run track. So typically I'd run cross country in the fall, and then I'd play baseball in the spring, because track is in the spring, but it would conflict with baseball. And again, I wanted to focus on baseball. But my junior year, I decided to do track, and I ran a 4:35 mile at a meet And the track coach at Xavier University of Louisiana reached out to my dad, was like, hey, I want to recruit your son. And again, I was born in New Orleans. My aunt went to Xavier, but as far as like what college was on my radar, it really just depended on which one wanted to pay me to play baseball. That was really all that I was looking at. Once the Xavier coach reached out, and I started thinking, I guess you could say, a little more realistically about my future. And my dad, said, hey, you ought to become a doctor. Just like any other kid, you're online Googling what professions make the most money. And that's kind of how you pick your college and your major when you're 18. And that's kind of how I picked mine. That's kind of how I decided well, that's not necessarily why I decided to go to Xavier. I went to Xavier because they offered me a scholarship to run, but everything else made sense too, right? So that's how I got in pre-med. Did well with it. First 2 years, again, I was focused on becoming a physician. But after my sophomore year, I got invited to do research at UCLA, where I was studying in the Mindful Awareness Research Center with Dr. Irwin's lab, where we were studying psychoneuroimmunology, which is basically how your mind and your behavior influence your immune system, or your nervous system, and then influence your immune system. Which I think my experience there has driven a lot of my perspective. Some of the perspective that I've shared here. It's why I think at the end of the day, that the most important thing is your perspective for shaping your life. And again, that just kind of introduced me to just more information about all of the problems that we deal with, that we spend the majority of our time treating the symptoms of, as opposed to getting to the root issue. And kind of got away from the idea of becoming a physician. I wanted to have more scaled impact. We build something that again addressed the root causes of problems. And after I graduated, finished up 2015, and from 2015 to 2019, really just exploring what I wanted to do with my life. Like, what do I want to spend the rest of my life doing, or the next decade of my life doing? So before I, just kind of went onto the hamster wheel or got a job, I just really structured my life to where I wouldn't really have to work that much. So I could do things like, Uber Eats, or, just driving Uber regularly, so that I could just kind of have some control in some sense of what I wanted to do. And then once I decided what that was going to be, during the pandemic, Xavier actually similarly reached out to me, this time to coach. So when I was in high school preparing for college, the track coach reached out to have me compete. And then, pandemic hit. They're looking for someone to help support on the distance side of the program. And he knew I was in the city. And so he reached out. He said, hey, he asked me if I was interested in going to school, because he'd pay for it if I coached. And so then that's how I ended up doing my master's of public health with concentration in health equity at Xavier as part of the third cohort there. And it's an incredible program for anybody that's interested in getting their MPH. I highly recommend it, because it properly orients people to solve health problems through a health equity lens, which is the most effective way to get the desired outcome. And so that's how I ended up in the program. I'm a graduate assistant coach, and I'm studying my master's in concentration in health equity. Took a lot of what I learned from that and incorporated it into how we roll out our products and services here at bEHR Health. And super grateful that I did it, because I did have a limited understanding of the problem, as many of us do. And I just feel like my ideas refined better, and I'm just able to execute much better.
And how did you hear about public health? Or was it just a happenstance that you got the job there and you were like trying to find programs that kind of fit, and then you did public health?
Yeah, I was actually considering PA school. Mm-hmm. So I'm really familiar with physician assistants, because my aunt is one. She also went to Xavier, and I was missing like 2 or 3 like labs. So I didn't necessarily qualify to apply to the PA program, and Xavier had just launched a public health program. And again, I just needed a program. And so Xavier didn't have very many graduate programs, and it was like master's in education. I could do master's in counseling. That was also one that I would consider. But because I had just come up with the idea for bEHR Health, I just felt like master's of public health was most appropriate.
That's awesome. And then what were some of your bigger takeaways from your MPH?
Yeah, I mean, policy is our strongest lever. I think early on, I almost decided not to pursue building bEHR after my first semester. So first semester, we're taking epidemiology, policy, biostats, and the policy class, again, it just kind of really opened my eyes to a lot of what we're talking about right now, right, with the big, beautiful bill and how much of an impact policy and the rules of our society affect health outcomes. There's nothing that comes close. And I 100% believe that. And so my goal actually after the first semester was maybe I should just go into policy work. I would love to help influence policy in this space. And as I learned more and more about our system and just how deep this stuff goes, right? I would, and then also just thinking about myself and the life I want to live and the experience I want to have overall, to spend a significant amount of my life trying to change the minds of people who don't believe in health and prosperity for all just sounded really stressful. And it's not to say that I'm glad there are people that do it, because we need people that do it. Ultimately, and so I still believe that it is the case that those are some of the most important roles in this space. But what led me to actually commit to building bEHR at the end of that year was the data potential that we have as a company with what we call the health score report, the Black electronic health records, which once we're able to stratify our data by different cities, states, zip codes, partnering organizations, and more, and be able to compare the average health score in New Orleans to the average health score in DC, right, or the average health score in New York. And then we can identify, okay, so what's happening in New York and DC that's not happening in New Orleans, that we can then implement, right? And then the next month we can evaluate it, right? I really saw a gap in real-time data in this work, not only because it's important, obviously, to measure things, but right now there's really no follow-up. There are activations all across the board. There are these health fairs, there are workshops, there's seminars, and everybody gets excited and motivated to prioritize their health or engage with the system. And then at most, there's the follow-up is, hey, I'm going to send you an email because you wrote your name on this list, or 6-month follow-up survey to see how this experience affected your health trajectory, right? But what if I saw how many steps that person took for the next 60 days after they went to this workshop about walking and health? What if I could see their eating habits following the workshop? That's really what I wanted to create, is a way to follow up and so that we can know which interventions were working the best. And so we can continue to invest in them and double that, and then have the data to back it up. And then ultimately our goal again with bEHR Health is to maximize health in the Black community. And I really want to know that we did it. I don't want to just kind of feel like it.
Yeah, that makes a lot of sense. And I think that I feel like we are going in a way in a place where like we can get more real-time personalized data on people. And like to your point, we should be able to see what health promotion things are happening and if it's actually something that's benefiting people, and like to what extent, and how can we better promote that, connect people within these different communities, understand what that data looks like among those different populations. I know you said Black community. Is it exclusively for black people, or are other people allowed on bEHR Health?
Yeah, everyone's allowed to download the app. I get that question often. I do think it's a testament to our branding that people even ask that question. And on some level, I do appreciate the thought, like the consideration, right? Because it's more often than not a non-Black person that's asking that. And it's not like, boy, can white people use it? Like not in the like kind of tongue-in-cheek way like that. It's usually like out of respect. And I think that's a good signal, right, for our society, that people would ask in that regard. Anyone can download the app. They can download it in the App Store, type in public health careers as their access code, and they will get into the app, be able to create their account and enjoy our community. The experience will be culturally competent, if you will. So they may see messages and push notifications and stuff that maybe they're not culturally aware of why certain things are said certain ways in the Black community. But I think, it's a good learning experience for people. Like a lot of the content that we'll put out in the articles and stuff will be talking about this problem. This is the problem that I'm trying to solve. I'm trying to solve the health problem in the Black community first, and second, I'm trying to build a business. If I was just trying to build a business, I would focus on the community or the market that's most open and interested in health apps and fitness. And what happens when most businesses that do set out to improve health, they follow that model. Which again, I have nothing against that, right? You're naturally we do that. we have in there are conditions that almost require that because you got to make money, right? And sometimes it takes a while when you're working with a market that's not necessarily looking for it as much as it might be in another market. But the reason I've continued to focus on the Black community is twofold. Again, this is the problem that I'm interested in solving. I took a lot of time to decide what I want to spend my time doing, and it's not building a tech platform for the ladies in LA, and even though we'd probably get bigger quicker, marketing there, but the policies, the practices, and the beliefs and structures that created these problems, right? These disparities that we see today were very targeted. They were very targeted and in unique and creative ways, and ultimately very effective. Because we have the results we have today. And so my understanding, and based on my education and training, is that the solutions need to be equally targeted. This is not necessarily even a matter of a racial thing. This is strategy. And if we design solutions with the community that we're trying to solve the problem for, the solutions will be more effective for those communities. So that's all I'm trying to do. Those who are offended by that idea, if you know a better solution, I will pivot, because again, it's all about how do I solve this specific problem. Maybe a slightly more politically correct answer is that when you do solve problems for the most dispossessed among us, right, the impact and learnings can scale up, right? If we figure out how to help Black people become healthy in the United States of America, the tips and tricks and learnings that we get from those trials can be applied to people who maybe are at a higher socioeconomic status, but maybe needed a message in a way that we learned from this work. But if I go and try to solve health for a middle-aged, well-to-do white woman in Los Angeles, not to continue picking on Los Angeles, she might not necessarily need as much as it relates to interventions to get to the specific outcomes that she's trying to get to, because she just doesn't have as many barriers. And then therefore, when I go to try to apply that to the Black community, it doesn't work. For certain parts of the Black community, it doesn't work. And so that's why we focus. But anybody can come on the app, and they're I wouldn't say that many. Again, we focus most of our marketing efforts in the Black community, but the non-Black people on the platform, they track their workouts just like everybody else. They support us just like everybody else. It's a great time.
Awesome. And I do appreciate the beginning of the answer of you seeing this as people seeing more of a safe space and being respectful of that safe space in asking the question, as well as you're doing a good job of marketing in the work that you're doing. So you've participated in multiple accelerator programs, Plug-in Ventures, Harvard iLabs, HBCU Founders Initiative. What were some of the lessons that you learned from there about scaling health-focused startups?
Mm-hmm. Yeah, I learned so much over the past 2 years. Man, I would say I've still been in school for the past 2 years. So I was in graduate school formally 2020 to 2022, with Masters of Public Health. 2023, really January 2023 to at the end of last year, 2024, or at the end of last year, so December 2024, I was in an accelerator program the whole time. Early on, I applied to maybe 20 plus venture capital firms, right, to raise some money. All of them said no if they even responded. And so I made a strategic shift to apply to accelerator and incubator programs. And so for those who don't know, these are basically boot camps for startups. So, a lot of founders who come up with ideas have never built a startup, let alone a company. And so there are a lot of things that we need to learn, and these programs help you learn those things without making the same, or having to learn from your mistakes. That's the greatest value that I get from these. Most of the time they come with some money. So $10,000 here, $20,000 here. And in the early days, especially when you're so dependent on external funding, it's really valuable. But, the most value that I've gotten out of them is the access to the networks that I have now. And so when I do want to go raise real money for the company, I can reach out to this network to say, hey, this is the stage that we're at. They also have been following our journey for years now, but it still is hard work. I applied to probably 120 startup accelerator and incubator programs over the past 2 years. And I don't know There may be some other people that have applied to that many programs, but when I talk to friends and they ask me like, how am I continuing to have so much success with raising money in these programs? It really just comes down to numbers. I mean, I think we have a decent idea and it's interesting enough to certain organizations, but if I only applied to 5 or if I only applied to 10, maybe I get into 1 or 2. But my job is to give myself the best chance at reaching the success that I want. And so I applied to as many programs as I could. And we've been able to raise a little over $500,000 over the past 2 years through that. And haven't really given up much of the company since we've done it through these grant focused programs. And so, yeah, I've done a ton. But the biggest learning as far as like how to scale a business is to put something out into the market that represents your product in some way, represents how people will engage with your product in some way, as quickly as possible, as cheaply as possible, and get some real feedback on your product or service. A lot of us will sit on an idea because we just don't think it's perfect yet, right? And then we'll just continue, going back and forth in our head about how someone will react to the product if they saw it or what they would think. The information that you get when you bounce your ideas up against reality versus the information that you get when you bump your ideas up against your own mind is so much better. It's just much better information. And so strategically, that's the information that you want, because then you can iterate from that idea or from that feedback into a better solution. And what will determine whether or not Bear Health becomes the best solution for solving health in the Black community is not going to be because I'm some genius that came up with an incredible idea. And not to say that we shouldn't leverage genius and stuff like that in any work. Like there is genius out there and sees and can see things that just the world doesn't see, and definitely leverage that. But I like to rely on things that I can control, or at least do all that I can with what I can control. And so what allows for startups to come in and blow past legacy companies is that they are testing more ideas against the problem that they've identified in the market that they're trying to solve a problem in than their competitors. They say you need 10,000 hours to become an expert. It's probably more related to the number of iterations that you made on an idea or trained on a skill. And so my goal as a founder as it relates to this problem is to talk to more people with the problem than anyone else and test more ideas against those problems than anyone else. And the outcome of that is that I will come up with the best solution, or our team will come up with the best solution. Not necessarily because we're the smartest people in the room, but again, we've refined the idea more than anyone else. And so that's what we're working on, as a company.
What do you do day to day as CEO?
Depends on the day, man. Depends on the day. I do have a team this summer. I have 4 student interns. They've been great, and they've taken a lot off of my plate. One of them is called our health navigator. So what she does is she engages with our users on a daily basis. So, thousands of people are doing workouts all day, every day on the app. And so she'll send a little note like, hey, keep it up. You're doing great. She sends push notifications in the morning and in the evening, just different messages, usually related to like having the right perspective towards your life. People seem to like those a bit. I talk to my administrative specialist every morning, and I go through my phone and identify what I need to do. So I go through all of my emails, see who I need to respond to, text messages, see who I need to respond to, Instagram DMs, like basically all of my channels. Because again, I'm day to day, I'm just in channels, engaging and looking for opportunity and responding to opportunity. And then, it just depends on what I have going on that day. The past 2 weekends have been crazy. I was in DC all weekend for Black Health Connect, incredible conference for anybody. Again, I'm looking to kind of expand their network in this space. But that was Thursday morning to Sunday evening at 1, I guess, Monday morning at 1 a.m. Nonstop Black Health Connect, engaging with new potential partners, sharing my vision as much as possible, right? Networking and stuff like that. And that was my day to day for 5 days. Got back. We had another major conference this weekend, Essence Fest in Houston, or in New Orleans. About 500,000 women come to the city to celebrate Essence Fest. And last year we got over 400 users in a weekend, just during Essence Fest. And so we had to prepare for that. So all day, every day, Friday, Saturday, and Sunday of this past weekend, talking to youth, talking to new community members. And I host a run club as well here in the city. So every Sunday morning, a group of us, we get together and do a run. And then afterwards we do yoga. But other than that, man, I've spent about 90% of my time over the past 2 years, 9 a.m. to 9 p.m. or 8 a.m. to 8 p.m. I'm in this office looking for opportunity, creating opportunity, and fulfilling our mission of predicting and preventing the chronic conditions that plague our community. Starting off, obviously, it was a lot of creating opportunity because we didn't have any users. We didn't have an app. We actually started off with an online health score assessment. We didn't even have a fully functioning app in 2023. And yeah, just kept taking action on the things that I know create the results that I want. And then eventually we got some results, and now I got some jobs to fulfill. And one thing I just try to make sure I do is that I never want to create a job for myself that I don't actually want to do just because it can, makes money. I want to make money and deliver a service that I actually like doing, that I like delivering. So yeah, that's the day to day. We are about to open up a space called Bear Connect. It'll be like coffee shop by day, wellness by night. So you'll be able to host run club meetups there. We'll host yoga, meditation. So my day to day will probably change a little bit. I will say that my day to day will start to be a bit more community facing moving forward. Yeah, interviews, just all kind of stuff, man.
That's awesome. Congratulations on all the success. And I look forward to seeing how Bear Health and your journey continue to grow and continue to make the impact, and definitely will be looking along while all of that happens. And I'm glad that you're able to share some of your story and some of your why behind that. And curious because I feel like tech startup isn't something that's like natural to public health people. How did you kind of end up on that route or thought process? And what advice maybe would you have for public health early career professionals, new graduates, to get into that type of work?
Yeah. I really wish I could pinpoint like why I wanted to bridge the two. So I lived in San Francisco for a year, and I was driving Lyft and working at the airport. So I drove a lot of San Francisco people around. I also took a class at Stanford while I was there, and obviously learning a lot about tech and AI. And as I thought about tech and AI as it relates to health, like again, we all know like where health is going, this personalized, real time kind of feedback and being able to intervene in real time based on that data. And there was actually one time I was driving a passenger, and he was asking me, what I wanted to do with my life. He assumed that based on our conversation, my goal wasn't to be a Lyft driver my whole life. And I told him, yeah, I'm doing research over here at the university. I have this kind of like brand idea that I want to do. And he's like, man, you got a lot of part-time things going on. And so I'm like, well, what do you do? Or what do you do? And he said he built a company, sold it for $5 million, and now it chills. And so that is really where I think I was first introduced to the concept of like building something and selling it, and then having enough money to not have to work, to pay the bills. It's not necessarily my vision to sell Bear Health, not in that way. But I think that those experiences planted a seed in my mind for what's the quickest way to solving a problem. That's really what I view startups as. Again, outside of policy, I view the startup approach as the most effective way to solve problems. So I think that's how it kind of ultimately brought them together. And again, the problem is urgent to me. And so I didn't want to, based on, what I knew about how public health things typically move, I didn't want to deal with a lot of the red tape that's typically associated with public health. I didn't want to deal with the pace that's typically associated with public health in general, less of a research focus, more of an action focus. Startups are a bit sexier. Then and so again, like, how do I get Black people to engage with health? That's what's at the root of everything that I think about and do right now as it relates to this. And public health is fine. The traditional landscape of public health is fine, but I think, a public health startup is a bit more exciting to think about. And so far so good. And again, you just have freedom. And I did not want to have to contend with people who don't agree with the ideas that we think are good for our community. Like, I don't want to have to do that. It's part of why I haven't taken money from certain types of investors and stuff, is because, again, not just doing this to make money. And so yeah, I just didn't want certain challenges. And being at the speed is like a really, really big deal here, because, again, people are dying early every day and they don't have to. And so you also get to make impact, like, from the very beginning. We haven't even launched our official product yet. We will be launching it in October, but we've already had several users walk down or off their medication just from walking. Several users last year did 1 million steps in 30 days. This is before we got to talking about trying to go after the world record. But most of them lost 20 plus pounds just from walking. It was an idea I had for a campaign. Can I walk 1 million steps in 30 days to raise $1 million? Few people liked the idea and started doing it. And the impact is there. I can launch a campaign on any day that I want. And if it fails, then it's on me, it's whatever. But just the freedom to be able to move like that and test ideas faster than you would in a traditional setting. I hear all my friends talking about how they hate their bosses all the time, and if they were in charge of things, it would go this way. And I just prefer that freedom. And so if somebody wants to get into it, start. Pick a part of the problem that you want to solve, and talk to as many people as possible who have that problem. Because one thing that I think public health professionals can appreciate or will appreciate about the startup space is that the foundation of a startup is that you talk to people with problems. You don't just have an idea and try to force it on people. You go talk to people that have problems, and you're not even necessarily coming with your idea to solve the problem. That's kind of the way that we did it, and that's not necessarily the best way to do it. I just didn't know when I came up with the idea, I didn't know the best approach. But my view of health equity is, in community-based participatory research, is that you don't identify a problem in the community, develop a solution, and then go try to implement it. You go talk to the community, ask them what their problems are, and then try to help them solve those problems. Now, whether or not you implement your solution or idea or not is not relevant to the situation. Your job is to solve problems for people. And then you might develop solutions as a result. And then you might have a company as a result. And so I think public health professionals appreciate that, especially those of us who are in the health equity space, that we get to go and talk to people directly, find out what their problems are, and then develop solutions based on that, as opposed to the kind of top-down model of solving problems. And so if you want to get into it, that's it. Just start. That's what startups are about. Go talk to people with the problem and go test solutions against that problem. And then once you get what they call a product market fit, where you're solving an urgent problem for someone who's willing to pay you for it, then you can go get some money and build a business. But yeah, just start. That's the mentality when it comes to this stuff. Just start solving the problem. You don't have to get this business idea put together and this plan put together. Just go start solving problems for people, and you might find a business.
Well, I appreciate your insights there. And I think it's so important to just highlight people with public health backgrounds in this type of tech startup world, because I feel like the lens and the perspective and the issues that we're solving are such important ones. And to your point, so impactful if we're able to make that, if we're able to meet the need that we're really trying to meet the need of. So I appreciate you for doing this work and for trailblazing in many ways. And I hope that there are many people that look up to you and say, hey, Kwame is doing something around an issue that's important. Let me do something very similar, and maybe even reach out to you and collaborate. So I appreciate you sharing that.
Yeah, of course. I'm trying as hard as I can. I hope that message is received and that characteristic is adopted, because that's That's how you give yourself the best chance at success in whatever it is that you're trying to do, whether you're trying to solve a public health problem or just have a good life. Try hard.
Absolutely. And I wanted to ask a quick question before we get into like past week's guest question and the Furious Five. You shared that like you took this time off after I think it was undergraduate to just kind of like figure things out.
Mm-hmm.
For maybe someone who is early career, maybe they're not taking an extended period of time off, but they're taking maybe 3 months, 6 months, or they're just trying to like literally find a job right now. What is some advice that you would give to them in that period?
Humble yourself and minimize your expenses first and foremost. Like if you want the freedom to spend any amount of time thinking about what you want to do, right? So not even necessarily just doing what you want to do, but to be able to like, go experience different things and learn about what's out there or what's possible for your life. Like it's really hard to do that with the pressures of bills, lots of bills. And so one thing that I think one thing that might maybe sets me apart a bit is just my willingness to kind of sacrifice certain levels of quality of life that allow me to again spend more time, introspectively with myself. Don't be ashamed to move in with your parents. And sometimes it's hard sometimes to move in with your parents, or with a friend, or with a family member temporarily, because it's not like you're just, you just don't want to work anymore. And you're just going to be crashing on their couch, and you have like something that you want to build. It's the right family member will understand that and kind of support that. Especially you're already showing you're willing to go get educated and do all these things. Like you're not a lazy person by any means. And so I think first be willing to do that so that you can again have the conditions in your life that allow for you to be in control of your time on some level. Um, Again, the next thing would be again like what I said before, which is go talk to people with problems. Like if I were to do it, if I had to do it again, like if I was coming out of a career, um, yeah, I would first reduce my expenses as much as I possibly could. Be careful, even if you're early in your career, not to build your lifestyle around, or especially if you're early in your career, don't build your lifestyle around your current income. One, it can be gone soon, for different reasons. And if you do find yourself where, you want to walk away, well, now it's harder to do that because you have this lifestyle that you built up. So I would just say, yeah, first and foremost, minimize your expenses as much as possible. Second, if there's someone who's living a life or has a career or, making an impact in the way that you kind of envision for yourself, go try to spend a lot of time with them. Maybe even work for them for free if you have the time and the bandwidth, or just lower pay. Right? Again, it's just like to want something is to be willing to sacrifice everything to that end. That's my understanding of what it really means to want something. Those who are willing to make those sacrifices to accomplish whatever it is that they're pursuing, whether that's something altruistic or something for themselves, those people will get there faster, and because there are less things in the way, less distractions. But yeah, network is like the quickest way to get there. Again, this is like all strategic. Minimize your expenses and surround yourself with people who are already there. And something good will happen. And I would also say have a clear vision of what it is that you want to accomplish. Clear vision, solid network, low expenses. You could do a lot, especially with AI here now.
And then you kind of spoke about this already, but the past week's guest question was, what's your next big initiative?
Mm-hmm. Yeah, so we talked about the bEHRathon. Please join us, because right now we have about 300 people registered for the bEHRathon. And the idea, again, is that we have to cover enough distance to reach the moon. And right now, if the bEHRathon were to happen today, each of us would have to do like, I don't know, 1,000 miles in a day. And that's not possible. So we need everybody. It took me a month to do 1,000 miles. Right. And I don't even think that that's something that most people could do. And so it would be impossible to do that in a day. So yeah, please join the bEHRathon. That campaign it's also a message around like our organizing capacity as a people. Like that, like we really got to get that down. We really got to get good at organizing so that you saw what happened with Target, right? Target has experienced losses each quarter since these campaigns against Target have started. So just look at that as an example of what we're capable of. And so this is just kind of another way to strengthen that. Like, can we share a message enough to cover enough distance to reach the moon for our health? Can we share a message enough to get 1 million people to move together on one day toward health for the Black community? And once that campaign takes off and we're on our official app, and then the health score report is developing, right? Whereby we're seeing the average health scores in each city, and now we're doing these challenges between different cities and which city takes the most steps on average. I'm excited for this campaign, but I'm more excited for what's to follow, because then my initial vision of creating a tool for individuals to track their personal health connected to a platform or data set that enables us to track collective health will be completely informed. And then now it's a matter of, again, getting in there and talking to as many people as I possibly can with the problem and testing as many solutions, so that once we get things right here in New Orleans, then we can go get things right in another city, and then go get things right in another city. Yeah, so that's what I'm most excited about. bEHRathon 2025, October 25th. We're completely virtual. You just have to log a mile or more on the app on bEHRathon day to help us reach the moon.
Awesome. Well, I'll be sure to link that below and in the show notes for anyone that is interested in checking that out. So the Furious Five, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Spend a lot of time with AI. Basically, AI is just going to help us get better at solving all the problems that we're interested in solving. So get familiar with how to use AI in your work, whether that's just helping you write quicker, helping you brainstorm ideas. I think like the idea that someone would even go to college in like 30 years, I don't even know if that's obvious. I think if I were a young student, or if I was communicating a message to a young student, it's just like, understand that the world is going to be changing very rapidly over the next several decades, and be open to a completely different landscape of what opportunity means and what you will be doing with your time. And the way that you stay open to that is by constantly learning. And so stay on the forefront of technological changes, and be smart and humble enough to pivot from whatever the traditional matter is. And also, I guess you could say confident or courageous enough to follow that intuition, because you're probably right. And you're at least not wrong about the current landscape being completely eroded. You may not necessarily be right about the direction that you're about to head, but you get more right as you try, you test more. So, yeah, that's what I would say to a student. The game's about to change. Make sure you're up to speed.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Yeah, pick a big problem to solve. I don't really think that we have anything better to do with our time on Earth, but solve big problems, or even little problems. Yeah, I'm really interested in solving big problems. It's fun to me, and if that's something that's fun to you, and like there hasn't been a single day over the past 2.5 years that I woke up and I'm like, man, I got to go to the office and respond to emails and talk to users. Like, there's not a single day, and I think there's something special about that, and I think I wish it for everyone, but it comes with, or it's rooted in like a big vision to solve a big problem, to be able to sustain that motivation and desire to do this work every single day. I would say, if you want to be in a position like me, and again, we're nowhere near the finish line, but I do think that there's something to say about my current state, and just like the flow that I feel like I'm in, that is valuable. And so, yeah, if you want to get there, think really big and minimize your expenses.
Number 3, what's something you're working on improving in your life right now?
Let's see. I mean, technically, I'm trying to break my personal best in the 5K this year. So I ran 15:30 in college, and my goal is to run faster than that this year. I would say, like, on a more personal level, I don't know if I'm actually trying to do this, or if I just think it's maybe something I should do soon or eventually. But once I have a team, see, right now I'm pretty much doing everything. Nearly have 7 jobs within my company. But as I bring team members on and able to take things off my plate, just trying to understand exactly how I shift back into a more balanced life. Because there's nothing there's nothing in my life that's, I would say, balanced, except for that I'm consistently working. I guess there's some balance to that for the business, but yeah, I'm interested to see how I shift back into just adding other priorities to my life outside of business, health, and family. Yeah, so I'm thinking about that a lot. I wouldn't say I'm necessarily working on it just yet, but I am curious to see how I adapt.
Well, I hope that you are able to gain back some of that joyous time in the near future,
Hmm.
to do
No, don't
with
get me
it
wrong.
whatever you like.
This is joyful too. Like that's my point. Like I don't really feel like when they say you're out of balance, I don't really feel like I'm out of balance. And in fact, when I try to incorporate more quote unquote balance, I feel a little distorted. Also, probably because there's just like 75,000 things I got to do every day, and any time away from it is just a lost opportunity. Because as an entrepreneur, you have to do everything, but you don't have to do anything. And so every day, like you choose it, and that requires a lot of focus.
That's real. That's real. Number 4, professionally, do you recommend anything?
Mm, professionally, can I get more context?
A book, a
Mhm.
piece of advice,
Got you.
podcast,
Mhm.
anything like that?
Yeah, for entrepreneurs, how I built this with Guy Raz or Raz,
Mm.
it's a podcast. Stories are really powerful, yeah, especially for entrepreneurs because it's a really hard game and really only entrepreneurs understand. And so I talk to a lot of my friends who are entrepreneurs all the time, and just to talk. I like to say that I outsource my mental health to other founders because friends they're gonna get it, but not the same way. They're not gonna understand what it's like to go from $10 in your bank account on Monday to 25,000 on Tuesday, and then negative 50 on Friday, and then keep going and showing up. They're not gonna understand that, and so it's important to have these folks. So yeah, I would say surround yourself with people who are going through the same experiences, have the same experiences, and listen to stories like the podcast on how I built this with Guy Raz. Book wise, I like A New Earth by Eckhart Tolle. Again, this is about like having your perspective rooted in a way that again allows you to engage the most positively with the world. I really like that book. Fasting is the most powerful tool for extending your lifespan. It also helps keep your mind clear, keeps you healthy, and minimize the number of things that you do that bring you immense joy with minimal effort. Because just like I was talking about earlier, as an entrepreneur, you have to do everything or you're responsible for everything, but you don't have to do anything. And when we're human beings, and so we're wired to, we're motivated by the reward, whatever it is. And some rewards are attained with minimal effort, right? $15 on a sensational meal, right? Clicking your TV remote and now you're entertained for hours, however many hours you want, And so I try to avoid doing those things often because it interferes with my willpower. The reward I'm looking for with bEHR has a much longer tail than turning on a TV. Not to say that I don't from time to time watch TV, but again, it's just a risk because um, if it takes me 10 years to get the ultimate reward with bEHR, I need to be able to have the sustained motivation to do that. But if I can go get the fulfillment, the same experiential fulfillment out of watching TV or hanging out with friends or whatever, then when I'm faced with a challenge in the company, it's harder for me to stay with it, to stick with it. And you need that willpower. So yeah, minimize the number of things that basically give you instant gratification on some level. It's a cheat code.
Number 5, if there was one piece of advice you'd give to your younger self, what would that be?
Yeah, someone asked me this about a month ago, and it was like keep trying hard. I think a lot of my friends felt like I was it's like naturally talented, but I was really just trying as hard as I could at everything. And maybe I do have some natural talent, and that's great. I'm going to leverage that too. But yeah, just keep trying hard. I think sometimes I felt like I was a try hard, just doing too much, doing the most, as we say. And there's a whole world out here of people who are way more talented than you are, who are trying harder. And there are people who are trying hard to create problems for you and other people. And so you have to become the greatest version of yourself. And you don't become the greatest version of yourself by shrinking to your environment because it makes people uncomfortable. So I would just say try hard and try harder than you think you need to.
Love that. Love that. Well, Kwame, thank you so much for coming on and sharing your journey and a little bit more about yourself and Bear Health. I definitely appreciate it and look forward to all the work that you are going to be doing.
Yeah. No, thanks for having me, man. I really appreciate it. Been on a variety of podcasts, and I just really appreciate the public health essence of this one, and really hope people get a lot of value out of our conversation.
Likewise, I definitely know they will, because I feel like public health and tech is something that a lot of people are thinking about. So I hope that you give them some ideas to think about as they are pursuing their careers.
Hey guys, don't forget to
Awesome.
download the app, find out your health score, engage in our community, and let's all maximize Black health together.
And housekeeping items, everyone. Thank you all so much for watching. Be sure to subscribe, leave a like, leave a 5-star review, and share this with a friend. Greatly appreciate you all. See you all next week. Peace, everyone.